Assalamualaikum and good day. Today, we will be presenting the awareness about anorexia nervosa. At the end of this video, you will know about the symptoms, causes, and treatments of anorexia. Most people might not know about anorexia nervosa. Anorexia nervosa is a serious and potentially life-threatening but treatable eating disorder. It is characterized by an extreme food restriction and an intense fear of gaining weight. It is formally known as an eating disorder. People with anorexia limit the number of calories and the types of food they eat. They may exercise compulsively or push the food they eat through intentional vomiting or misuse of laxatives. Anorexia can affect anyone, no matter the gender or race. However, certain factors put some people at greater risk for developing anorexia, including age, gender, family history, dieting, changes in trauma, certain careers, and sports.
Moreover, here are the symptoms and signs for anorexia nervosa, which is emotional and mental signs, behavioral signs, and also physical signs. Intense fear of gaining weight, an obsessive interest in food, calories, and dieting, being unable to realistically assess your body weight and shape, having a distorted self-image, feeling irritable or depressed, experiencing thoughts of self-harm or suicide. Changes in eating habits or routines such as eating food in a certain order or rearranging foods on a plate, a sudden change in dietary preferences such as eliminating certain food types or food groups, using diet pills or appetite suppressants, compulsive and excessive exercising or extreme physical training, significant weight loss over several weeks or months, not maintaining an appropriate body weight based on your height, age, sex, stature, and physical health, unexplained change in growth curve or body mass index (BMI) in children and still growing adolescents.
Let's see what is the causes of anorexia. The physical signs and symptoms of anorexia are related to starvation. The exact causes of anorexia is unknown. As with many diseases, it's probably a combination of genetics, traumas, environmental and culture, peer pressure, and mental health. Causes anorexia by genetic is not yet clear which genes are involved. Genetic changes make some people at higher risk of developing anorexia. Some people may have a genetic tendency toward perfectionism, sensitivity, and perseverance associated with anorexia. Individuals who have experienced trauma are more likely to engage in eating disorders such as bulimia nervosa, binge eating disorder, and anorexia nervosa. This is due to the state of the individual's brain organization and development.
Environmental and culture. The environment that we live in can influence and lead to anorexia nervosa, which is family dynamic and school and workplace environment. In culture, we have teen ideal, dieting, and weight loss culture, cultural attitude towards food. Peer pressure is when people feel pressure to comfort their friends and peers in order to fit in to be accepted. When it comes to anorexia nervosa, it can be body ideal, comparison and competition, and influence of media. Lastly, emotional health. We have low self-esteem and emotional trauma. Low self-esteem can make individuals susceptible to society, pressure, and unrealistic beauty standards. And then for emotional trauma, individuals with anorexia nervosa often have a strong drive for perfection and control, setting excessively high standard for themselves.
There are several ways to treat anorexia. Firstly, people who has anorexia can see a psychotherapy. Psychotherapy is a type of individual counseling that focuses on changing the thinking and behavior of a person with an eating disorder. Secondly, people who has anorexia can take medication. This is because medication can help to manage anxiety and depression. Thirdly, nutrition counseling also one of the strategies to treat anorexia. This is because counselors help restore normal eating patterns. Lastly, family support is very important to anorexia treatment success.